Hippa, and the Compliance Program. Hippa stands for Health Insurance Portability Accountability Act. It's the law, and it's the right thing to do. This means that your health information is kept private and secure. Only those people who must have information about you to provide care or process your records should know your private health information. An organization can be fined each time it breaks the rule up to $25,000 per year. We must go to great lengths to keep our patients' information private. From the visitor who passes a computer screen, the housekeeper who cleans your hospital room, or even employees talking in an elevator should not learn anything about your information because it is private. It must be protected, and it is called Protected Health Information. HIPAA guidance does not access personal health information for personal reasons. The following information is not meant to be inclusive, but to give examples of misuse of personal health information for personal reasons. Looking up birth dates, addresses, appointments, test results for family and friends, neighbors, reviewing the record of a patient out of concern or curiosity, looking up a staff member's medical or financial information, discussing patient information with family, friends, other staff when it is not related to your job, reviewing patient records to use information in a personal relationship, compiling a mailing list from hospital records for any reason except as defined by your job duties. Here are some ways to protect patient privacy. Not talking about patients in public places like the cafeteria, elevator, by the water cooler, in lounges, waiting rooms, or parking garages. Being sure no one can see your computer screen while you are working. Never sharing your access code. Logging off when not working on your computer. Changing your code and notifying your supervisor if your code becomes known to anyone else. Not leaving information on answering machines or emails because you don't know who can get your messages. Leaving only your name and your number on message machines when you are asking patients to call you back. Being sure you are in a private area when listening to or reading your messages. Knowing who you are speaking to on the phone. If you're not sure, get a name and number to call back after you find out it is okay to do so. Using only a standard phone because cellular phones can be scanned. Never leaving documents unattended. Store, file, shred, or destroy according to your department policy. Making sure fax numbers are correct and use a cover sheet with a confidentiality statement. When calling patients in waiting rooms for appointments or talking to them in our healthcare facilities, talk to them in a way that does not disclose their full name, their doctor, or their reason for their visit to others who may overhear. Even when a patient has someone with them, they may not want that person to hear their private information, so ask the person to wait outside. If the patient requests them to stay, that is okay. So why do we need a compliance program? To provide guidance, ensure quality health care is provided through constant monitoring, communicate appropriate conduct, to promote compliance with federal and state regulations, to foster and promote ethical conduct. The Cherokee Indian Hospital Authority Compliance Plan can be found on Policy Tech. The compliance plan addresses billing claims submission standards, operating in-house laboratories, EMTALA, Stark anti-kickback and proper referrals, patient confidentiality, establishment of hotline, avoidance of healthcare fraud. The compliance plan is updated annually. If you have any questions on the plan, contact Terry Morris. Any violations could result in disciplinary action up to termination. All complaints are investigated. Compliance oversight. Ongoing activities such as training and education, communications related to compliance, preventative practices, policies and procedures. Ongoing monitoring include auditing of programs, voluntary reporting, hotlines, and investigations. Auditing and monitoring. Periodic audits to evaluate this compliance program components will be conducted. Random billing and coding reviews, formal audit reports will be made to the Compliance Committee and appropriate executive committee, survey employees, interviews, and document reviews. Government investigations. All employees shall immediately notify the Director of Quality or any executive director upon receiving a contact from a governmental agency who are or may be conducting an investigation. Employees will not solicit or accept personal gifts, favors, loans, cash, uncompensated services, or other types of gratuities or hospitality from organizations doing business with the Cherokee Indian Hospital Authority, competitors of the Cherokee Indian Hospital Authority, co-workers, patients, families of patients, or referral sources. Occasional gifts of nominal value are acceptable. Seek guidance if unsure. Stark and anti-kickback laws. The Cherokee Indian Hospital Authority will ensure it does not enter into financial arrangement with physicians designed to provide inappropriate remuneration to Cherokee Indian Hospital in return for the physician's ability to provide services to Medicare and Medicaid beneficiaries. Entities in which the providers have an ownership or investment interest will be reviewed for appropriateness. Commitment to medical necessity. The Cherokee Indian Hospital ensures that only claims for services that the Cherokee Indian Hospital has reason to believe are medically necessary are submitted to third-party payors. All Cherokee Indian Hospital providers will provide documentation that supports the medical necessity of a service that has been provided and billed. No individual will be employed who has been convicted of a criminal offense related to health care. No individual will be employed who is debarred, excluded, or otherwise ineligible for participation in a federally funded health care program. Criminal record checks will be done on all new employees. Standards and procedures. Commitment to medical necessity. All care provided must be reasonable and necessary, appropriate to the situation, and provided by properly qualified individuals. Provides the highest quality of care. All employees must support the mission to provide health services of the highest quality that respond to the needs of our patients, their families, and the community as a whole. Healthcare professionals must be licensed or certified. Each professional will be duly licensed or certified as required by state and federal law and provide services allowed in the scope of their license. For code of conduct violations, discipline will be consistent. Sanctions could be written warnings to termination. All employees will have due process. The following are examples of unethical behavior. An employee takes supplies home for his or her personal use. An employee falsifies an employment application. An employee times out for another employee. Patients are charged for services not rendered. Code of conduct. Employees and agents shall comply with all applicable laws and conduct all business practices with honesty and integrity. Compliance is everyone's responsibility. Be sure to report your concerns. There is no retaliation for those reporting. Compliance may not be used as a defense for otherwise initiated disciplinary matters. The hotline number is 800-455-9014. Please review the Cherokee Indian Hospital Authority Compliance Plan located on Policy Tech. The Cherokee Indian Hospital Authority Code of Conduct is also located within the Compliance Plan. All employees will sign a yearly attestation for both plans.